Hi everyone. So about a week or so ago, I had a blood draw and a meet with my oncologist and my gynecologist oncologist. And before my appointment, I think it was at like 10:30, I was able to see my blood results per usual, and my CA-125 was elevated. Less than 30 is considered normal. It was 86. And that's my tumor marker and how we look for progression of disease or if it's staying in remission, my ovarian cancer that I had. So I was absolutely devastated. I did not feel good about that. Um, and then I had a meeting, appointments with them both that day. And my oncologist usually comes in and he's super excited and very happy to see me and very joyful. He walked in very tentatively. Um, I've never seen him behave like this. And his first question was, "How are you?" And I was like, "I'm upset," because I had just like burst into tears. I was like, "I cannot even believe this is happening," because I don't know. Of course, it can happen, but my CA-125 had been pretty much 4 in most of my blood draws. The last one after my surgery was 15, but I had inflammation because of the fistula and surgery, and so I expected it to go up. These are things that I would expect, so I wasn't really too concerned about it. And now I'm at like 6 month marks where I'm getting blood draws and physicals to check for recurrence. And this was my first 6 month or my second 6 month checkup or follow up. And I never really worry about this stuff. I don't get CTs regularly, just a blood draw. And CA-125 is basically an inflammatory marker. So if you have any inflammation going on in your bowel or digestive system, it's also for different kinds of gynecological cancers or breast cancer, peritoneal cancer. They might look at your CA-125. And because it can elevate with so many different parts of the body, it's not a very reliable blood draw, but it's the only thing I have in ovarian cancer to look for recurrence. So my oncologist and I were both very upset. I think he's been very optimistic about my case, and I have been too. And I don't worry about it. I just let it be, but maybe I subconsciously worry about it because when I saw that number, I was really, really upset. I was like, I cannot believe this is happening. But it's also just been such a long road to recovery and to feeling normal and getting my hair to grow back and be able to put it in a ponytail and all of that, that I was just like dealing with the chronic pain for as long as I had. I have a new job and I'm super excited about my new job. It makes me very happy to be doing what I'm doing now. And I went back to the floor. It was something I didn't want to leave. And, I worked in my previous job because it was a good job. It would allow me to heal, and it wasn't super stressful. So it was good for what I needed. I was still able to be a nurse and use my nurse brain and stuff and learn and grow and all of that, but I really just wanted to become more skilled on the floor still. So I have a new job and I just started orientation. I got this tumor marker, and I was like, oh my God, I cannot even believe that like this is happening. And just thinking like having to, maybe leave or whatever. So we got this tumor marker. My physical exams came back normal from both physicians, and they were like, well, let's do a CT. My oncologist told me it's not the most reliable. I wouldn't, jump to any conclusions yet. Let's do the CT and go from there. And both of them said, if the CA-125 comes back abnormal, we do the CT, and if CT comes back normal, we repeat the blood work in 6 weeks. So I do another CA-125 in 6 weeks to see if there's any rapid increase in the level. If there is a rapid increase in the level, I don't know what the next step is because my CT came back clear, but that doesn't mean maybe something is going on that I can't see. But as of right now, the CT is showing no signs of cancer. I was so sick thinking about this being elevated and just already ready for the worst, because that's kind of been the trend. And, trying to stay neutral, trying to stay just neutral, just like, let's see, or whatever. But it did get the best of me on several occasions where I was crying and, going at work, and you hear about cancer all the time, like and just chronic illnesses with your patients and stuff like that. So it's like, it's kind of hard not to think about it when you work in healthcare already and you're dealing with things like I do. And, but the CT came back clear. It showed no evidence of malignancy in my chest, abdomen, or pelvis. It also showed that the fistula that I had started to get better. So there's a little bit of an improvement. It's going to take a while for that to actually heal. And I took a screenshot of my results and I texted it to my oncologist, because he gave me his cell phone number a long time ago. And I said, I can't believe that this actually came back clear. I was just so prepared to have bad news, and I'm really happy and I'm really excited and I'm going to go with it. But his response was, I'm glad that it's clear, but let's keep a close eye on it. So, if he's telling me that, the most optimistic guy that I've ever worked with, then it does raise an eyebrow for me, but I'm going to be okay for now. I got 6 weeks until my next blood draw. If I start feeling any kind of like pains or, something going on in my abdomen or something like that, I'll let him know. But as of right now, the CT isn't picking up anything. So I'm good with that. But the way I describe what he said is, we're going to be tentatively optimistic. We're going to watch that blood draw, and see what's happening. My gyne oncologist said, she hasn't reviewed or told me anything about the CT, but she said the first time when I saw her a week or so ago, she said she's seen the CA-125 be elevated, have a normal CT, and then the next blood draw is normal. She's like, it does happen. She didn't give me any kind of percentages or anything like that. It's just because that CA-125 is just not very reliable. So we'll see what happens. And I do have an inflammatory process going on in my body. I have a fistula. And I've been on a lot of steroids over the past 3 years. So who knows, maybe those steroids were keeping the inflammation down enough to where my CA-125 wouldn't be so high. I have no idea. There's a lot of complex things going on in my body. But for now, if you were praying for me, so far we're doing really good. I'm so excited, so happy. I was not prepared to have good news because of just the trend of my life in the past several handful of years now. So yeah, I'm just really happy to mostly just continue giving and serving and being, the best nurse that I can be for the patients. I really do enjoy hearing people, empathizing with people, and even more so now that I have gone through as much as I have, that, I know what it's like to live this life of uncertainty and pain and having your life uprooted and all of that. So I just have a little extra understanding, and I do enjoy being there for people and to hopefully offer them something, if it's not peace, at least just an understanding of someone that's just next to them that can be like, yeah, it's horrible. It's horrible to go through these things, and you're right, it is. And you can only do so much, you can only handle so much, and you can only take so much as a human being going through any kind of chronic health problem. So I do like being there for people, and I do think that is like my purpose. And I really do enjoy giving that every single day and doing my best. Am I the most perfect nurse? Probably not. But I do my best. I do my best, and I learn every day from every single person that I work with. And I always appreciate that. And I find nurses to be some of the greatest people I've ever met. So I feel very honored to stand by you and be with you, and learn from you and your expertise. Because I still consider myself a young nurse because of, having to leave the floor so early, not getting the repetitions that I wanted before I came off the floor. Anyway, that was long-winded. um, but if you could just celebrate, and let's continue to put out the good vibes, the prayers, the positivity, that this continues to just hopefully be nothing, because that was a very daunting thought. Thanks so much, guys. Take care.